Before using Xiidra Dropperette, make sure to read the Patient Information Leaflet from your pharmacist. Use this medication in the affected eyes as directed by your doctor, usually twice daily, once every 12 hours. To apply the eye drops, wash your hands first, and be careful not to touch the tip of the single-use container or let it touch your eye or any other surface to avoid contamination. Remember not to open the single-use container until you are ready to use it, and after use, throw away the remaining contents of the container right away. If you wear contact lenses, remove them before using the eye drops and wait at least 15 minutes before putting them back in. Tilt your head back, look upward, and pull down the lower eyelid to make a pouch. Hold the dropper directly over your eye and place one drop into the pouch. Afterward, gently close your eyes, and place one finger at the corner of your eye near the nose, applying gentle pressure for 1 to 2 minutes before opening your eyes. This will prevent the medication from draining out. Try not to blink or rub your eye. Repeat these steps if your dose is for more than one drop. If directed to use this medication in both eyes, repeat these steps for your other eye. Use the eye drops before eye ointments to allow the drops to enter the eye, and wait several minutes for your vision to clear before driving or operating machinery. Use this medication regularly at the same times each day to get the most benefit from it, and make sure to tell your doctor if your condition lasts or gets worse. If you experience eye discomfort, temporary blurred vision, or an unusual taste sensation while using Xiidra Dropperette, single-use dropper, it's important to consult your doctor or pharmacist. They have prescribed this medication because they believe the benefits outweigh the potential side effects. While many people do not experience serious side effects, it's important to seek medical help immediately if you notice symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. If you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA, and in Canada, you can report them to Health Canada. Remember, it's always important to follow the recommended dosage and take the medication at the optimal time for the best results. Before using Xiidra Dropperette, single-use dropper, it's important to talk to your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that could cause allergic reactions. Make sure to discuss your medical history with your doctor or pharmacist before using this medication. After applying this medication, you may experience temporary blurred vision. It's important to avoid driving, using machinery, or any activity that requires clear vision until your vision has returned to normal. If you have upcoming surgery, make sure to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it is not known if this drug passes into breast milk, so consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions that may alter the effectiveness of your medications or increase the risk of serious side effects. Always keep a record of all the products you use, including prescription and non-prescription drugs, as well as herbal products. Make sure to share this list with your doctor and pharmacist. It's crucial to seek approval from your doctor before starting, stopping, or changing the dosage of any medicines. If this medicine is swallowed, it can be harmful. If someone takes too much and experiences serious symptoms like passing out or difficulty breathing, it's important to call for emergency help. In the US, you can contact your local poison control center at 1-800-222-1222. If you are in Canada, reach out to a provincial poison control center. This medication should only be used as prescribed by your doctor. It is not recommended to share this medication with others. If you forget to use Xiidra Dropperette at the scheduled time, use it as soon as you remember. If it's close to the time for your next dose, then skip the missed dose and continue with your regular dosing schedule. Do not use a double dose to make up for the missed one. It's important to use Xiidra Dropperette as directed by your healthcare provider for the best results. It's important to store Xiidra Dropperette at room temperature, away from light and moisture. Keep the medication in the original foil pouch until you're ready to use it, and don't store it in the bathroom. Remember to keep all medications away from children and pets. When you no longer need the product or it has expired, it's important to properly discard it. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. It's best to consult your pharmacist or local waste disposal company for the proper way to dispose of this product. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.